Well, hello. We're here with Dr. Pittaway. Hi, Dr. Pittaway.
Good afternoon.
Good afternoon. Dr. Pittaway, there's lots of patients out there. You're a dentist, and there's lots of patients out there who they have missing teeth in the back. 1, 2, maybe 2 or 3 missing teeth. And frankly, they're missing sometimes for quite a while. A few years, and nothing really all that bad seems to have happened. And yet, every dentist will say that you got to replace those missing teeth. Can you shed some light on it of like, why isn't it all so bad apparently, and yet why do they need to apparently replace it?
Well, Helmut, there's nobody ever died from missing teeth. I guess teeth aren't for everyone. But it makes a big difference in your health and how you can chew your food and just your quality of life if your dentition is intact and working properly. If you lose some teeth on the bottom, the top ones frequently will change position slowly over time and drift down out of place, makes them harder to clean, and causes problems when you try to fix them later.
Okay.
That also increases your risk for some periodontal problems up there.
Okay. So basically, if you lose some teeth, you say it increases the risk for periodontal problem. How does it do that? Why is that happening? And what does that do to us?
Well, when you lose the normal, natural relationship of tooth position from one tooth to another, it opens up spaces where more dirt collects and more opportunities for bacteria to invade your mouth. And it's not reversible when you have that sort of damage.
Yeah, that I've heard. I've heard that when you get periodontal disease, which is basically an inflammation of the gum, that's an inflammation which is, as you, I think, said in another video, which is kind of like going into the gateway of the blood vessels via the mouth and enters the kidney and the liver and the heart and the brain and gives all kinds of problems. And so what you're saying is when there is teeth missing, that type of stuff is happening, it can easily happening.
Oh yes, absolutely. It opened up the roots for decay. It opens up the gums for infection. And of course, digestion begins in the mouth. So if the food isn't being chewed properly, you're swallowing large lumps and chunks of food that give you a stomach ache. You get a lot of acid in your stomach sometimes because you can't digest your food as well as if you had chewed it properly.
Okay. Well, that of course I've heard, and all of us have heard that many times. Of course, that doesn't help a guy like me. I seem to be having most of my teeth in it, one way or the other way, and I just go up and down it goes, and my wife keeps telling me not to do so. But of course, it makes it more difficult to do so if there is some teeth missing. What about misalignments? When like there is teeth missing, I've heard some dentists saying that, because a tooth is missing, you chew more on one side or on another one, and by doing so, you get your hinges basically like a door. When it has hinges, you get them misaligned, and you get tension in your neck, and maybe even headache. Is there some truth to that?
Well, when we have a bite that is misaligned, or the back teeth aren't hitting properly, or hitting unevenly, or hitting on one side, the human skull has a lot of ability to adapt and adjust to these problems, but there comes a point where it starts to cause damage to your jaw joints, pain, muscle pain, headaches. The whole thing gets out of balance. Your jaw's out of whack. You get grumpy. It's just no fun.
So there is some truth to the fact that if your teeth, if your mouth isn't working properly, that you might be getting tensions and headaches and stuff like that. So that there is some truth to that. You acknowledge that? You say yes to that? Yes.
Oh, absolutely. I see that in my patients all the time. A common problem that they have is the tension headaches, because their jaw is not functioning correctly. The teeth need to be in harmony with the muscles in the joint, so that there's not a lot of conflict, which shows up in the muscles, and there's always a mode of failure. The teeth will break, teeth will get loose, the teeth will wear down, the jaw will wear down. Something's got to give when they're not in harmony with each other, and so we always strive to create a bite that's in harmony with the muscles of chewing and the jaw joint.
Well, that sounds pretty awful to me, to have to have tension in your neck and in your back and having headaches only because of perhaps because of some missing teeth. So that's, I think, definitely a reason to go and fix them. Well, thanks for telling us, Dr. Pittaway. We'll ask you a few more questions about other topics very shortly.
Well, thank you.
You're welcome.
You're welcome.